Well, this is an interview with Dr. Larry Altman on July 12, 2008 at the Centers for Disease Control and Prevention in Atlanta, Georgia, about his role in the Smallpox Eradication Project. The interviewer is Carolyn Kunline. With this interview, we're hoping to capture for future generations the memories of participants and their families involved in eradicating smallpox. This is an incredibly important historic achievement, and we want to hear about your experience, Dr. Altman. I have some questions to guide you, but please feel free to recount any special stories or anecdotes that you remember about events or people. So, Dr. Altman, would you please briefly describe your childhood and your pre-college education? What influenced you to become interested in public health to begin with?
Well, I grew up in Quincy, Massachusetts, just outside of Boston, and I came from a family of physicians and heard a lot about medicine. That's what I knew, but I had many other interests in going through prep school at Milton Academy and then at college at Harvard, and went on to medical school at Tufts. And I'm not sure that I knew about public health growing up when I was a high school student, but a lot of the elements of public health were clear to me. I always thought in terms of a denominator, even though I did not know what a denominator was and didn't learn that until I got into epidemiology. But I always thought of broader scopes and always thought of what was outside of the horizons that I could see. That came naturally to me.
And how did you get involved with epidemiology?
Well, in medical school, and actually before medical school, I had read stories by Burton Ruchet in the New Yorker about epidemiology that whetted an appetite. In medical school, we were one of the few medical schools at the time. I graduated in 1962 that had a course in public health, and Dr. Count Gibson was the instructor and head of the department, and as part of the public health experience, he knew that I had worked for a newspaper outside of Boston, the Quincy Patriot Ledger, and had an interest in journalism. And he knew about the program at CDC that Dr. Alex Langmuir ran in the Epidemic Intelligence Service program. So I had heard about that, and I think I made contact after that from Dr. Gibson's initiative, and then later heard Dr. Langmuir give a lecture and in Boston, and that all whetted my appetite. I then went on with my internship in San Francisco after medical school, and it was during that time that I had applied to the Epidemic Intelligence Service, the EIS program. I did it in between internship and residency at that point because of the potential for the Vietnam draft, but I would have done it under any circumstances. The program interested me and I wanted to do it. The issue was the timing of it, not the doing of it. It's when I did it. And the first go around, they said the budget had been cut and they were going to have fewer recruits than usual. And in the meantime, I heard about an epidemiology program in San Diego to evaluate the safety of reclaimed water. So I signed up for that with the Public Health Service as an epidemiology program, knowing that CDC didn't have a position that year. Later, CDC called back and said, a budget increase had come through, we have the money and we want you to come. I explained that I had already signed up in San Diego, and they said that's no problem, you can still come. But it became a bureaucratic problem because the people in San Diego insisted that I go to San Diego. Dr. Langmuir insisted that I come to CDC. Dr. Langmuir won the battle, and I came as an EIS officer and came to the meeting, I guess it would have been about April at the time of the annual EIS conference, and the new recruits came and we were told more about the program, and applied for and given our assignments at that time.
Okay, and how did you become involved with the Smallpox Eradication Program at the CDC?
Well, during the the assignment recruiting period in April, there were a number of positions that were offered, and we had our choices for which we could apply. One was for the editor of the Morbidity and Mortality Weekly Report, the MMWR. And I applied for that because I had an interest in journalism, and I thought that would be a good way to learn a lot about epidemiology, and I could still, I was assured during the interviews during that week, go out on outbreaks as they occurred and could work that out. So I did apply for it, and to the ever gratefulness of all my classmates, I got it. Every one of them was horrified. Not one of them wanted that job, but I took it. And I did that for a while. And during the time that I was doing it, they needed somebody to go to West Africa to follow the field trials that have been given for the Measles Immunization Program, actually the Measles Immunization trials that were held in Upper Volta, and they were conducted out of NIH and the FDA. And the trials were completed, and then the West African governments of the countries involved wanted the vaccine. Merck had been the manufacturer, and they were very aggressive in selling the vaccine idea to the governments of those countries, which was basically French West Africa. And I think it was DA who said, how would you like to go to Bobo Dioulasso and for a few weeks? And I said, okay, before I had a chance to get to the map and find out where Bobo was, and when I saw it was, you know, West Africa and learn more in the non-joking part of it, I got interested in the idea that we could go and run a campaign against measles. The concept of that was to eliminate or eradicate measles by a very poorly conceived plan or blueprint by USAID. As I recall it, the concept was that if you vaccinated the children under the certain age, 25% of that group for 2 successive years, by herd immunity, you would wipe out measles. Well, there was no public health or epidemiological or scientific basis for that thinking. That was just a bureaucratic thinking that had come up. But I went and I agreed to go, and it took a long time to get over to do it. There were a number of delays. But I did, and it was a momentous occasion. The delays began with the fact that I guess between NIH in Washington and CDC in Atlanta, there were innumerable delays in terms of decision making as to the timing and so forth. When the time came up and I was ready to go, there was a dock strike in New York, and ships were kept in port, and they had all the material that was needed for the immunization program. Everything from jet guns to the materials for the vaccination for the field trips, the trucks that were needed to transport the refrigerated vaccine. There were refrigerators in the trucks, and I believe when I got to Africa, we just had to wait for a long time before any of the material arrived. But then when it arrived, we ran into problem after problem after problem, and it began delaying the timing of the measles immunization program. There were incredible gaffes that came up that seemed, at least to me, to be inexplicable. One was they had meant to buy a lot of iodine tablets to put into purify the water that we'd need when we were out and traveling through Africa. And these were iodine tablets. But somebody at the USAID had decided that globulin, which was the trade name for one of the iodine tablets, really was gamma globulin. So they bought tons of gamma globulin and sent that. It stayed on ships and it was unrefrigerated, and we had to toss away a valuable human blood product because of, at best, typographical errors. More realistically, the people just didn't know what they were ordering, and we had to waste a product. And there were all sorts of other problems. We had problems with the refrigeration of the vaccine because the refrigerators couldn't work above 90 degrees Fahrenheit, I eventually learned. But before I learned that, we had refrigerators in the trucks and they just wouldn't work. And we'd light the butane gas to heat the refrigerators and nothing would happen. And I learned that as you do in the field and you're trying to just learn as you go along, that the Israeli ORT organization was very skilled in practical technical problems that would come up in West Africa or elsewhere. And I went to their technicians and they came and looked at the refrigerators, and I think it was they eventually found out, after a lot of blind avenues and trials of trying to get them to work, that they would not work above 90 degrees Fahrenheit. But of course this is what they sent to West Africa and the Sahara Desert. And meanwhile I was cabling back to Washington telling them we had problems because we couldn't get the refrigerators to work, and how were we going to keep the vaccine cold? And the vaccine was heat dependent, or cold dependent. If it was heated it would be destroyed, and therefore the whole campaign would be worthless if we vaccinated with an ineffective vaccine. There was a lot of cable traffic, and at one point I received a cable when I went to the embassy in one of the countries and received a cable that said, we understand your problem, and if you take the trucks and park them in the shade, that will lower the ambient temperature, and by lowering the ambient temperature you'll be able to get the refrigerators to work. I received that in the Sahara Desert, where the tallest bush I could find may have been maybe a foot high or a foot and a half high. There was nothing that would cast a shadow or anything that would lower the ambient temperature in the area, and the heat was as it would be in a desert in West Africa. So I, in frustration and in humor, because I had been on the Harvard Lampoon, I composed a reply cable demanding an emergency air freight shipment of 10,000 Dutch elm trees. This was a Buy America program, and therefore you had to have American products for everything that was used. So I said if that rule applied, I would settle for a shipment of 10,000 chestnut trees. And sent off the cable and went on my way. A little later I learned that the ambassador of one of the countries that I was working in, I would get this cable in every country because they were repeated to as you went around the countries that were involved in the program. And I received the advice of one of the ambassadors who said, I just couldn't send that cable because with all the mistakes that went on with this program, and there were many more than I've outlined, I am certain they would have shipped the 10,000 trees, and we would never have been able to account for this. That in many ways, with the humor and with the seriousness, described what the problems were with the program. And the logistics were just enormous. People hadn't been prepared for what life and work would be in West Africa, particularly for an immunization program of the scale that had been designed, and this put us way back. This program was operating in at least 8 and maybe 10 West African countries in what used to be French West Africa, and it belonged to a group, the OCCGE, which was the French name for the organization for the organizations pour le, contre les grands endemis, which were the epidemic diseases and endemic diseases, and therefore I was traveling between all these countries. The aim was that I and another worker would train the Africans infirmières, the health workers, to learn how to use the jet injectors to deliver the measles vaccine into the arms and vaccinate the babies and young children. And we would set these demonstrations up and try to teach them how to use it. But this required some sterile techniques, and this was a new concept for many of the workers because they hadn't been used to this type of equipment. They weren't used to the technology, and they weren't used to the need for sterility in a type of situation where if you contaminated the machinery, it could spread the whatever contaminant or microbe was there to a number of recipients. So this was a constant concern. And but as I said, we were working in several countries simultaneously, and I'd sequentially go around and visit them and try to teach them how to use the jet injectors and deliver the vaccine. As I said, a lot of delay had occurred because of a dock strike, but also we got a late start into the season for that reason and for other reasons, and it began to coincide with the natural measles season. So I was concerned and kept communicating the concern that we might be starting to vaccinate just the very time that the natural measles season would occur, and therefore it would be misunderstood by the Africans that the vaccine was giving the disease to their children if they happened to come down with measles in that period of time before the vaccine would take effect. And sure enough, that happened. And we got into political problems because the Chinese communists were quite active in the area and capitalized on that and spread the word that the Americans were spreading measles through the vaccine. So a lot of the work I had to do involved visiting American embassies and trying to work this problem out with the country's political representatives in the area. And there, as a background, there had always been a minor type of tussle between the French and the Americans because the Americans used the Edmundston D strain, which was a product of Merck, an American country, and the French had wanted to use a French version of the vaccine, and in an area that used to be French West Africa, but they weren't paying for the program, so it was an American program. So that's a lot of the background of what happened in how I got involved in the early days of the measles immunization program. As a result of this, back at CDC, everyone was upset with the way the logistics had been coordinated and the lack of a real public health, epidemiological, and scientific backing to the strategy of vaccinating just a portion of the children each year, and thinking that herd immunity would eliminate measles, which is not a concept that holds any water. So CDC, and particularly D.A. Henderson, kept negotiating with USAID and other officials, and they wanted to, they were arguing to drop the measles program, and they wanted to put smallpox in its place. But USAID didn't want to drop measles, so a compromise, as I understood it, was reached, and they did the measles smallpox for a year or two, and then eventually dropped the measles part of it, and it became the Smallpox Eradication Program in West Africa. And from all that I know, I believe that this would never have happened hadn't I had this experience and turned it into through events into the Smallpox Eradication Program. And as I have joked with DA that maybe the real credit belongs to the stupidity of USAID that led to the problems that began the situation, and if things had run more smoothly, maybe we would never have gotten to the point of their being able to add smallpox to the eradication program.
So how long, Dr. Altman, were you in West Africa, and did you go anywhere else to work on smallpox eradication?
I was in West Africa for a trip that was supposed to have been a few weeks for the better part of a year. I don't remember exactly how many months, but it led to extension after extension after an extension. And I finally came home only because I needed to come back for the EIS annual meeting in the spring. And I did. To a rousing welcome that I remember that we had fun. But that whole time I was working on the program over there, although I did visit a few other countries. I should add that during this time, D.A. Henderson, in whose office I worked, D.A. Henderson, Don Millar, and I shared a set of offices. There were 2 offices and secretaries in the room in between. And it was from DA that I first heard of the concept of eradication at a lunch table in a discussion long before the opportunity to Africa came up. And I had never been taught anything about eradication as a concept. And that had always stayed with me. It was well, and eventually career changing, but it was just a thinking changing process that you could eradicate a disease and in a public health sense do something that you couldn't conceivably do as one individual practitioner or a group, that you needed to think in the most global concept. It's now called global health, but that was totally new concept for me, and that was in 1962, 1963. As I say, I spent the better part of the year, I think it overlapped with New Year's, in West Africa. I was always encouraged to see as much smallpox as I could. DA said free rein to see any other diseases, tropical diseases, but keep a particular eye out for smallpox during this period. So I used to go to clinics and hospitals, and I would see smallpox and I would see other diseases there, and I believe I reported back on the smallpox there because that was of particular interest to DA and CDC. I did not go on with the smallpox eradication program thereafter. I came back and went on to the Division of Foreign Quarantine, which was in Washington, which was not any part of CDC, but CDC wanted to annex. And I was sent over there as for my 3rd year, and I'm not sure what the word would be, liaison or eventual way of bringing the foreign quarantine service to CDC, which it did. Because up until then, CDC didn't have any authority or authorization to do work outside of the United States. And even though we went to West Africa for USAID, I guess it was under contract with USAID and to whatever extent WHO. So that was all new to CDC at the time. And I came back, spent that year, and then went on to complete my training in internal medicine and fellowship out at the University of Washington. And then I joined the New York Times as medical correspondent. And I came back and wrote about the end of smallpox after the eradication program had progressed, and we were down to the last cases in India, Bangladesh, and I went over to cover that. But it became a more momentous occasion because when I arrived, or just before I was to leave the United States, they had shot the sheikh and his family in Bangladesh, and I had the only valid visa to get into Bangladesh as any member of the New York Times. So the Times wanted me to get in there and to cover the political story as well as the eradication of smallpox. But the borders were closed, and the Times reporters had been shut out. So I went to Delhi, met with DA, met with, I can't remember if Bill Faggy was there at the time, I suspect he was, and then traveled across India and to get into Bangladesh. But before I did, I was in Patna, and there was I was greeted by Larry Brilliant, who told me he was on his way back to Delhi, but that by going into Bangladesh and staying in Patna to have an experience I'd never forget. Well, he was right, because as we traveled around that afternoon before he took his plane, the Ganges River was roaring at a fast clip through Patna, and people were walking around pointing to the river, and I didn't quite understand the magnitude of the problem. But that night, in the middle of the night, Louis, the houseboy, shook me awake and dragged me out to the front of the house that I was staying in with other WHO people and pointed to a tidal wave coming down the street, and it was the Ganges. It had broken the dikes, and the Ganges was flooding the area. So we woke up the other person who was in the house, and we moved whatever we could from the bottom floors to the top floors, and that included motorcycles and included equipment, but there was no food and water around. But we got to the top, and the waters clearly went to the second or third floor levels, and we were on the top where it was dry, but it was hot. The temperatures were in the 100, or over 100, and you had to hide to get out of the heat of the day. In the first part of this experience, it was just amusement to see how India coped with a disaster, and people in Patna coped with a flood and a disaster. And that went on for a day or two, and then at night you'd hear the dacoits, who were the people who went around robbing houses at night, and you'd hear them at night. But then as time went on, it got to be much more serious. There was no food and water. I think we had a couple of bananas to begin with. The water that had been there in the tank on the roof, the houseboy had left the faucet on and drained it, so we had no water for backup, and there certainly wasn't bottled water around or other materials, so we had to make do with what we could, hoping that we'd get out. And of course the Indian government had been sending out boats to try to rescue us, but they couldn't get very far because the Indians would try to get their animals into the boats and have them try to rescue those, so they gave up on attempts to reach us by boat. And it was too deep to wander through. And further, the waters would not only were filthy with sewage, but cobras were swimming around all over. So we had to sit and watch this. And then finally we decided, as time went on, that we were going to have to build a raft to get out. And we cannibalized beds and the slats from the beds. We used the inner tires from the motorcycle, and we put together a raft. And by this time I had dysentery, so anytime I tried to get up, I would have postural hypotension or I'd faint, and I had to maneuver myself. I could work while I was lying down, but it was hard while I was trying to get up and stand up. We went out the first time with the raft, but the raft caught on a picket fence or some kind of fence that was below and punctured the tires, and the raft sunk. So we had to go back and start all over again. And we did this, and I think a day or two later we got the raft back together, and we made one more attempt, and this was successful. And we got ourselves to the railroad station, and it was the first day that the trains were running out. They were up on an embankment, and the trains went, and we went to Benares. And all the time I'd been on this roof, which was about a week, with no food and water. The first thing I drank was as much tea and Coca-Cola I could find on the train. But the whole time that I was up there, I would look for the cobras. If I could see them, that was more comforting, because at least I knew where they were, and I don't like snakes. And if I couldn't see them, they were hiding. Only later did I learn that they were coming up through the plumbing in the buildings, but I didn't know that at the time, or I would have been more horrified. But we made it out, and when I got to Benares and made it to a hotel, the very first thing that happened as I walked up, there was a snake charmer with a cobra around him, and I felt I was never going to escape the cobras.
In what ways has this whole experience around the smallpox eradication and then your later travel to India impacted your life or your career?
Well, it's certainly the experience that I had in West Africa and later in India just clearly established the fact that that so much could be done in public health that hadn't been done. Here we were using a vaccine that had been developed in the late 1700s to eradicate a disease in the mid-1900s. And while there were certain other technological improvements that came along that made it possible and easier to do it, such as freeze-dried vaccine, jet travel, refrigeration, it clearly showed that something that could have been achieved, that is, if not the eradication, the elimination of smallpox in certain areas could have been achieved on a much wider scale long before it did occur. And it just made clear that if people got their heads together, had a spirit of adventure, of conquering, of not letting impediments get in the way, that you could make major contributions in public health in a way that hadn't been made before, and there was so much to do. And that was an indelible impression, and it made it clear that you could do so much more reaching a larger group of people, that is, in public health, than you would on a one-to-one basis as a practitioner. And we need one-to-one relationships with practitioners, or whenever we're sick, we would not benefit from that. But it just broadened the horizons of what could be done. And that was an important event in my life in thinking that way, and thinking that things could be achievable, even though at times when you were depressed about what was going on, you never thought it would be possible to achieve it. I try to use my experience and interest in journalism and medicine and public health to write about it all, and that buoyed that interest. And the fact that I could come back and write about the end of smallpox and chronicle it for stories for the New York Times was something that came out of it. I'm not sure if I hadn't had the experience and even was at the times, I would have appreciated the significance as much as I did by having that background experience. But certainly it did contribute, and contributed to writing about a lot of other events in medicine and public health.
Great. And is there anything else you would like to add?
I don't know. What else have people talked about that I'm not thinking about? Types of issues.
Well, if you want to go into a little bit of detail about your relationships with the country counterparts that you worked with in West Africa?
My relationship with the country counterparts in West Africa is that I was dealing with officials of the OCCGE, the health organization responsible for the epidemic and endemic diseases. Many of them were French expatriates, but there were a large number of West Africans involved. I saw the problems from their point of view, from the lack of sufficient equipment. Many of them were well trained, but they didn't have material to work with. I'm talking about this 1960s, beginning then, when we had so much less equipment and technology in medicine than we do now. But I would go around and visit hospitals and missionary hospitals, been called on to diagnose illness in children. And in one missionary hospital, driving through the countryside of one of the countries, one of the missionary nurses presented a child to me, and with the symptoms of an enlarged liver and enlarged spleen. There wasn't much else that one could think of in a young child, 4 or 5 years old, other than malaria. So you would try to treat for malaria, because any of the other diseases that they'd have, you wouldn't be able to treat in those days in that kind of setting. You'd have to send them to a referral hospital. And so you had to think out of your head as to what was treatable and or curable by the simplest means that you could of treating. You didn't have the x-rays, you didn't have you had your stethoscope, you had your fingers, you had your head, but it wasn't the technology of a large teaching hospital in the United States. May have been large teaching hospitals in some of the countries, but it was unrealistic to get sick children around a country, and you certainly weren't going to fly them from remote areas in the bush into the capital cities. And many of the children would have died by the time they reached there. So it was a whole new way of thinking that certainly wasn't part of your training in medical school or house officership. And it forced you to think in a different way on your own.
That's great. Well, thank you so much for speaking with me.
Well, you're more than welcome. Thank you.